Okay, so today's topic is on adolescent health. The term adolescence origin from the Latin word adolescere, to grow into maturity. The adolescent is the phase of that part of our life in which we grow from childhood to adult. It is the transition phase from childhood to adult, and 10 to 19 years of age is adolescence. Okay, for further convenience, we have divided adolescent phase into three: early, mid, and late adolescence. Early is 10 to 13 years, 10, 11, 12, 13. Mid is 14 to 16 years, and late is 17 to 19 years. Okay, WHO age period 10 to 19 years for both sexes, married and unmarried people. And there is early, middle, and late as adolescence, and youth is 15 to 24 years, and young people 10 to 24 years. So during adolescence, what happens? There is body structural changes under steroid hormones. Okay, along with that, there is also cognitive changes and psychological changes, whereas adolescence comprises all these factors like psychological changes, cognitive changes, body structural changes under steroid hormones. Puberty only means the physical changes of the body. Okay, physical changes means there is secondary sexual characteristics which appears under sex steroidal hormones. Okay, so now the stages of adolescence. Then early adolescence, 10 to 13 years, it is characterized by a spurt of growth and the beginning of sexual maturation, and young people start to think abstractly. Actually, in childhood, they are concrete thinking model. Concrete thinking model, they can't think reasonably. They don't know the future aspects of what they are thinking now. They are very much impulsive. They prefer same sex peers. Okay, and they are very much they are very much immature, they are very much impulsive, they are under pressure of some social expectations, family problems, parent child conflict, etc. And in mid adolescence, they are now more matured, they can think reasonably, they are abstract thinkers, mid adolescence. Okay, and they now feel detached from the family. They feel that their parents are their enemy, and their friends are actually their well wishers. Okay, and they are now interested in the sexual anatomy. They are experimental about sexes. They start masturbation at this age, that is mid adolescence. And in late adolescence, most of the pubertal changes have now established. They have their own identity. Okay, they are not impulsive at all. Their family relations are more important than the friendships. Peer acceptance is not now compulsory for them. Okay, they start thinking for their future, they set their goal, they think for their own career, and most of them or many of them are sexually active by now. So why adolescent health is important? Because major physical, psychological, and behavioral changes take place, and sexual maturity and onset of sexual activity has started, and there is development of adult mental process and adult identity, healthy responsible parenthood, great human resource for the society, growth spurt and physical activity, menstruation, pregnancy, these all are made at adolescent. So adolescent in India, in India, 23% of population in India are adolescent. Half of the group is sexually active before marriage. Fertility rate is high in adolescent. There is unsafe motherhood, increased rates of maternal mortality and infant mortality. there is low knowledge about family planning and healthy sexuality. And National Family Health Survey 3 shows that 19.8% of women in age group of 15 to 19 are pregnant. Age specific fertility rate for 15 to 19 is 107 by 1000. 59% knows about condom. 49% knows about OCP, and contraceptive use among married adolescent 15 to 19 is 7%. And half of them suffer from nutritional anemia. Young people between age of 10 to 25 years make up 50% of all new HIV infections. Now, what are the top killers of adolescent in India? Mainly there are increased suicidal rate, drowning, road traffic accidents, anemia, TB, burn, and cancer. Among the news, drowning, suicidal rates are more in adolescents. So there are physical growth, psychological growth, and physiological growth. So the onset of puberty depends upon the genetic and environmental factors along with the body fat stores. Okay, so there is activation of the hypothalamo pituitary adrenal gland. Okay, so there is production of sex steroids from the gonads, that is estrogen and testosterone, and androgens from the adrenal glands. Okay, under these influences of these hormones, there is secondary sexual characteristics, that is breast development, increase of the volume of the testes, penile enlargement. Okay, and there is pubic hair, underarm hairs, acne, etc. So for sexual growth in girls and boys, we use Tanner staging. Have you heard about Tanner staging? Okay, so there are 5 stages actually. In female, puberty starts with what? Menstruation, then thelarchy, that is development of breast. After that comes puberty, that is development of pubic hair. After that come menarche. Menarche usually comes 2 to 2.5 years later than thelarchy. Okay, and the median age for woman puberty is 12.6 years, and the range is between 10 to 14 years. In case of boys, the range is 9 to 14 years. Okay, there may be early puberty, there may be late puberty. So during early puberty, the testicular volume is actually when increased to 4 ml, and the penile length is around 2.5 centimeter. Okay, then in late puberty, that is during Tanner stage 5, the testicular volume increases up to 24 ml. And the penile size increases to more than 4.5 centimeter. There is cracking of voice in case of males, which is completed at the end of the puberty by deepening of voice. Okay, and in case of female, there is increased fat stored underneath the skin at the end of the puberty, and maximum growth spurt occurs in female before menarche. So 11-year-old female will be taller than a 11-year-old male. Growth spurt occurs later in case of male. Okay, then we can see that 20 to 25% height is gained in this adolescent period. Okay, boys gains around 28 to 30 centimeter, and girls gain around 16 to 24 centimeter. So there is a growth spurt. Okay, so for this growth spurt, we need what? We need more of calcium, we need more vitamin D. So these increased calcium and vitamin D requirements are achieved by intake of proper food that is rich in micronutrients, that is rich in protein and calorie. Okay, and as there is an increase in the lean body mass and blood volume also, both are rich in iron. There is an increased demand of iron also, and also there is starting of menstruation, so there will be blood loss, that also increases the need for iron. And another thing is worm infestation, which further increases the need for iron. There will be blood loss. Okay, so 800 milligram per day of calcium is needed for this, and to achieve 800 milligram per day of calcium, we need to take at least 500 ml of milk daily. Okay, and vitamin D requirement is at least 600 international unit per day. But there is lack of exposure to sunlight. Why? Because of the clothing system. Some religions wear burqa, or there are some restrictions for the girls. Actually, they are not allowed to go outdoor, right? So there is also lack of vitamin D, and there is also lack of vitamin A in underprivileged society. And WHO recommends at least 60 minutes of physical activity to maintain the cardiovascular fitness and muscle fitness. And there is also psychological growth, that is cognitive development. Okay, volumetric and functional studies have shown that there are some changes, structural changes in the brain. So these are not directly related to the these are not directly related to these changes, but it is thought that the changes in the brain, the structural changes in brain are to parallel the changes in the cognition and the psychological changes. Okay, so it increased cognition, increased need for privacy, lack of impulse control, increased intellectual ability, risk taking behavior. So these are the psychological growth. Okay, now come the adolescence and family life. So family life education, educate the growing children, especially the adolescent, regarding various aspects of living in a society and interacting with others at different levels, along with imparting age appropriate knowledge of biological and sexual development. So two kinds of needs. They are current normative needs associated with changing physical, sexual, cognitive, social and emotional development, future family related needs. And adolescent and family life are কি আসছে না, human relationships, values, morals, ethics, family as a basic unit of society, career goals and planning, diet and fitness, decision making behavior, problem solving behavior, these. And adolescence and nutrition I have already discussed. So now comes the adolescent counseling, that is early adolescents. I have said that they are concrete thinkers and are unable to clearly understand the cause and effect between their behaviors and their health. They are unaware of the consequences of what they are thinking or what they are doing currently. Okay, and in mid adolescence they think more abstractly, that is they are reasoning. Typically they are capable of complex logical thinking, and in late adolescence have a longitudinal understanding of how their behaviors affect their health. That is they are now aware of their own identity. So counseling focus on risky behavior and coping skills. Now adolescents mental health. So adolescents are prone to anxiety, depression, increased suicidal attempts, obsessive compulsive disorder. Okay, so why they are more there is a more frequency, increased frequency of suicidal attempts, because they are anxious. Most of them suffer due to depression. Okay, there is parent child conflict in the home. Suicidal behaviors are also seen in the families. Most of them are using drugs as substance abuse, so there is increased risk of suicidal attempts. So an effective way to address is by enhancing the primary care pediatrician in the recognition, treatment and referral of the adolescents to mental health specialists. So we have to check them in a regular basis, and we have to pick up the risk factors. Adolescent sexuality encompass whole range of thoughts, feelings, fantasies, emotions, desires and language besides action. So sexual behavior is only a part of it. So sex education is very much important at all ages, but it is more important than it is imparted during childhood and adolescence. Sex education on self-awareness, personal relationships, human sexual development, reproduction, and sexual behavior is needed. So human sexuality is a function of the total personality, attitudes toward being a man or woman, and relationships among members of the same sex and the opposite sex. Okay, so adolescent health problems. So adolescents are at the peak of their growth, though they face various health problems. Why? Because they are under immense pressure of rapid changes of their hormone. There is rapid changes in the ideas and concepts of the world, and they have to cope up with the expectations from the society. So they face various health problems. So what are those health problems? There will be nutritional problems, there will be mental health problems, there will be sleep disturbances, there will be infection including the sexually transmitted infections, there will be menstrual problems, substance abuse, there will be lifestyle diseases, and there will be some vulnerability, that is physical and sexual abuse. Okay, so now we'll discuss the nutritional adolescent problems. So there may be undernutrition, iron deficiency, anemia. Okay, so undernutrition leads to impaired growth, anemia, iodine deficiency. So I have already discussed that there is increased risk of increased demand of iron in adolescents due to increased blood volume and lean body mass. But this iron is not the required iron is not made properly in the underprivileged society due to reduced intake of iron rich food, and there may be uh, various other problems, like there may be heavy menstruation in girls and worm infestations. Okay, so anemia, and the prevalence of anemia in India for the last 3 decades have not changed. So prevalence is adolescent girls range from 22 to 91%, and National Family Health Survey prevalence in 15 to 49 women is 56%, and prevalence in 15 to 49 years old men is 24%. So what are the reasons for iron deficiency? Increased requirement for growth, menstrual loss, dislike of iron rich food, frequent dieting. And what are the other nutritional problems? That is obesity, I will discuss later. Eating disorder, that is bulimia nervosa, anorexia nervosa. What happens in anorexia nervosa? Anyone? You have studied it in psychiatry, no? Anorexia nervosa and bulimia nervosa. পড়েছিস তো? টার্মটা শুনেছিস? একজন বল। Adolescents are very much aware of their self-image, body image. They try to weight, they try to lose their weight. Okay, they try to keep their body thin. So anorexia nervosa, they eat very less, though they are underweight. Though there is various micronutrient deficiencies, they eat much less. Okay, and if and they use purgatives, they use fingers to their oropharynx, okay, to vomit out the what they have eaten. This is anorexia nervosa. And in bulimia nervosa, there is binge eating. They eat vigorously, okay, and then vomit it out. This is bulimia nervosa. Okay, and another problem is obesity. Prevalence of obesity and overweight is 11.1% and 14.2%. So why there is obesity? Obesity is due to lifestyle problems. That is, they are spending more time in indoor games, in video games, more internet use, more screen time. So there is reduced physical activity. Moreover, there is increased academic activity during adolescence, তাহলে ওরা বসে বসে শুধু পড়াশোনা করছে, কোনো ফিজিক্যাল অ্যাক্টিভিটি নেই। অ্যান্ড দেয়ার ইজ ইনক্রিজড পিয়ার প্রেশার, বন্ধুরা যা খাচ্ছে আমি তাই খাবো। সো ইনক্রিজড ফাস্ট ফুড টেকিং। As a result, there is obesity. So obesity will lead to what? Fatty liver, future metabolic disorders like dyslipidemia, type 2 diabetes mellitus, PCOS, hypertension, cardiovascular diseases. Okay, so there will be obesity. Okay, then reproductive problems, that is reproductive problems, that is teenage pregnancy. 16 to 19% of total pregnancy are teenage pregnancy. So these teenage pregnancies, there will be increased chance of, as the age is very lower, that is there will be preterm labor, preeclampsia, and increased rate of postpartum hemorrhage. And the child born to this adolescent girl will be undernutrient. There will be increased infant mortality rate, child mortality rate. Okay, and abortion related problem, yes, they use unsafe abortion methods, and girls from problem family are 2 times at higher risk. And there are other reproductive problems like acne, reproductive tract infections, irregular menstrual cycles. After 2 years of menarche, the menstrual cycles are irregular. They are associated with dysmenorrhea, basically primary dysmenorrhea, not secondary dysmenorrhea. Okay, do you know what is primary and secondary dysmenorrhea? Secondary dysmenorrhea is when there is a cause for dysmenorrhea, like endometriosis. And primary dysmenorrhea, there is no definite cause. And in adolescence period, there is most commonly primary dysmenorrhea is there, which subsides with time. Okay, so there is acne, irregular menstrual cycles, and sexually transmitted disease that causes vulvovaginitis, urological issues. Okay, so as there is more exposure, there is chance of more infection like TB, HIV, skin and parasitic infection, and sexually transmitted diseases. So what are the sexually transmitted diseases? Like gonorrhea, chlamydial infection, candidal infections, and pelvic inflammatory disease. As why they are more prone to STDs? Because their mucosa is incompletely estrogenized, and there is lack of knowledge about the barrier methods of contraception. Okay, so gonorrhea causes what? Gonorrhea causes vulvovaginitis, urethritis, prostatitis. Chlamydial infection causes postcoital bleeding or intermenstrual bleeding. Candidal infection may cause white discharge and comes at and cyclical method, মানে cyclical changes এর মধ্যে আসে। আর নেক্সট হচ্ছে যে pelvic inflammatory disease. It is manifested as lower abdominal pain and white discharge. There will be tenderness in the lower abdomen or adnexal tenderness. In pelvic inflammatory disease, it is a polymicrobial disease. So we give a blanket therapy. Blanket therapy like cefixime 400 mg BD for 7 days, metronidazole 400 mg BD for 14 days, and doxycycline 100 mg BD for 14 days. Okay, there are some behavioral problems like drug experimentation. It has been seen that 40% and 20% men above the age of 15 which uses tobacco. Other than tobacco, there is also alcohol use, cannabis use, opium use. Okay, and for the substance abuse, there is increased risk of road traffic accident, injuries, suicidal attempts, aggressive behavior, conduct disorder, violence, bullying. Okay, now prevention of adolescent health problems. প্রাইমারি প্রিভেনশন দ্বারা তার আগে আমি একটা জিনিস ডিসকাস করে দিই, এখানে নেই, সেটা হচ্ছে স্লিপ ডিস্টারবেন্সেস। ডিউরিং অ্যাডোলেসেন্স দেয়ার ইজ ইনক্রিজড sleep duration. Okay, but there is a physiological delay of melatonin secretion, for which there is a delay in an onset of sleeping and as well as awakening from sleeping. Okay, furthermore, there is and it is compounded by the urban girls or boys, because there is increased academic activity, increased internet use and increased screen time. তাহলে তারা আরো বেশি করে কি করছে, রাত জাগছে। এখন নিয়মটা কি, যে রাত 2টোর সময় ঘুমাতে যাওয়া, তাই তো? তোরাও তাই করিস তো? ম্যাক্সিমাম লোক কখন ঘুমাতে যাস? রাত 2টো, রাত 3টে, এটাই এখন তো নিয়ম। তোরা কখন ঘুমাস? অ্যাভারেজ টাইম কটা? হ্যাঁ বল। আচ্ছা, so there will be increased daytime sleepiness, reduced school performance, there will be conduct disorder, behavioral disorder, and so and so. Now, prevention of adolescent health problems. So primary prevention is the policies, information and education. Secondary prevention is identification and reduction of the risk factors, and tertiary prevention is that giving treatment and rehabilitation to the adolescents. So there are some adolescent health programs like Kishori Shakti Yojana, Balika Samriddhi Yojana, Adolescent Friendly Health Services, National AIDS Control Program. Okay, একটু নাম RMNCH plus A strategy. So priority intervention area on adolescent health, like adolescent nutrition and IFA supplementation. Facility based স্কুলে IFA ট্যাবলেট দেওয়া হয়, হয়তো? Okay, then facility based adolescent reproductive and sexual health services, information and counseling on adolescent sexual reproductive health and other health issues. Okay, education about menstrual hygiene and preventive health checkups. Okay, many underprivileged girls lack the access of safe sanitary napkins. ঠিক আছে, so they don't want to go to school during the menstruation. So RMNCH plus strategy focus on menstrual hygiene and some preventive health checkups. Preventive health checkups like general checkups, whether there is anemia, whether the girls or boys are underweight, these are checked. A nutritional education system to generate awareness on balanced diet, nutritious food, and effects on malnutrition. So nutrition education sessions through Kishori Divas, ICDS school curriculum, and also linkage with Shakhar Bharat Abhijan. Because if there is not proper, there is lack of micronutrients, there is lack of calcium and vitamin D, there will be late onset of puberty, there will be sexual maturity will be impaired. Okay, then child health screening and early intervention services. একটু আগে দাও। The screening of adolescent for low body mass index and counseling at adolescent health clinics. IFA tablet, it is National Iron Plus Initiative Program যেটা ছিল for management of anemia, adolescents within school weekly iron folic acid supplementation, that is WIFS, এটা লাগবে, ঠিক আছে? weekly iron and folic acid supplementation. Out of school will be reached through AWC. So IFA for adolescent is blue color tablet, ওটা অনেকগুলো কালারে আসে। The WIFS scheme is community-based intervention, address nutritional anemia among adolescents, covers adolescent in class 6 to 12. So weekly supervised administration of IFA iron to koto thake, iron 100 mg with folic acid is 500 microgram, and screening of target group for anemia and required referral. Biannual deworming, 6 monthly, 400 mg of albendazole stat dose followed by another dose of albendazole 400 mg after 14 days. Then information and counseling for improved dietary intake and prevention of worm infestation. Now, adolescent friendly health services. So level of care at sub-center, at PHC and CHC, community health center and primary health center. So sub-center, the service provider is the health worker or ANM, and they target the married and unmarried, and activity is during routine sub-center clinics. আর PHC তে medical officer, the service provider is the medical officer. Target group is adolescent unmarried boys and girls. The activity occurs once a week, teen clinic organized for 2 hours. So what are the services provided in the adolescent clinic? Clinical services like general examination, nutritional advice, detect and treat anemia, easy and confidential access to MTP, antenatal care and advice regarding childbirth. Okay, RTIs and STIs detection and treatment, HIV detection and counseling, treatment of psychosomatic problems and de-addiction also. Okay, these are clinical services, and counseling services are also given. Is information and counseling on adolescent sexual health. This is called life skills, the abilities for adaptive and positive behavior that enable individuals to deal effectively with the demands and challenges of everyday life. This definition is by WHO. What is the life skill education? Now, teaching through participatory learning methods like games, like role plays, group discussion, and practicing skills through experimental learning in a non-threatening setting. So it provides individual with wide alternative and creating way of solving problems pertaining to drug abuse, sexual abuse, teenage pregnancy, early sexual experimentation, bullying, etc. So it's a promotional program which improve positive health and self-esteem. So life skill education. It should be taught at also school level to increase the critical thinking and creative thinking. It helps in decision making and problem solving. It increases the communication skill and interpersonal relation. It helps in coping with emotion and stress, self-awareness and empathy. So life skills and educations are incorporated through schools, ICDS and community outreach session. Okay. Now, scheme for menstrual hygiene. As I have already discussed that most of the underprivileged girls cannot access safe sanitary napkins. This scheme promote better hygiene and ensure adequate knowledge and information about use of sanitary napkins. Sanitary napkins are provided by the National Health Mission in the name of free days. Okay. Preventive health checkups, like new approach in the implementation of school health program, mobile school health camps by a team consisting of 2 medical officers and 2 paramedics. Okay, this is called Rajiv Gandhi Scheme for Empowerment of Adolescent Girls. 200 selected districts. Objectives are enable self-development and empowerment of adolescent girl, improve the nutrition and health status, awareness about health hygiene and family child care, upgrade home-based skill and vocational skill. Then comes the Kishori Shakti Yojana. It has been redesigned of the already existing adolescent girl scheme being implemented as a component under the centrally sponsored ICDS scheme. It aims at empowerment of adolescent girls so as to enable them to take charge of their lives. So adolescent girls who are unmarried and belong to families below the poverty line and school dropouts are selected and attached to the local Anganwadi centers for learning and training activities. Scheme 1, the age group is 11 to 15 years, and Scheme 2, the age group is 11 to 18 years. Okay. IFS supplementation, education for school dropouts, non-formal education to adolescent girls, emphasis on life education aspects including physical, developmental and sex education is given. Balika Samriddhi Yojana, the same objectives are there. And there is also National AIDS Control Program. This is important, like under NACO, Adolescent Education Program developed which focuses primarily on prevention through awareness. The Adolescent Education Program is one of the key policy initiatives of NSAP2. So relevant messages on safe sex, sexuality and relationships are developed and disseminated for youth via posters, booklets, panels and printed material. The adolescent education program, the same things. Juvice Youth Unite for Victory on AIDS. আমি এটা ডিসকাস করছি না। ওকে, আচ্ছা, ইফ দেয়ার ইজ সেক্সুয়াল অ্যাবিউজের যদি কোনো পেশেন্ট আসে, তাহলে আমরা কি কি করব, পেডিয়াট্রিশিয়ান কি কি করবে, বা যে ক্লিনিশিয়ান ওটাকে মিট করছে তারা কি কি করবে? ফার্স্ট অফ অল উইল টেক কেয়ার অফ দ্য ইনজুরিজ, ওকে, উইল টেক ব্লাড স্যাম্পল and body fluid sample by trained personnel, and we will give medicine to prevent conception, that is কি দিই আমরা, লিভোনরজেস্টিল 2টো ডোজ দিই উইদিন 72 আওয়ার্স। পড়েছিস তো? ওকে, তাহলে ওটা উইদিন 72 আওয়ার্স দিতে হবে। প্রোফাইল্যাক্সিস এগেনস্ট এসটিডিস দিতে হবে, 1 গ্রাম অ্যাজিথ্রোমাইসিন স্ট্যাট দিতে হবে, সেফিক্সিম দিতে হবে, মেট্রোনিডাজোল দিতে হবে। ঠিক আছে, আর কি কি দিতে হবে, যে এইচআইভির জন্য কিন্তু প্রোফাইল্যাক্সিস দিতে হবে, আর তারপর কি করতে হবে, ওকে সাইকোলজিক্যাল কাউন্সেলিংয়ের জন্য আমাকে সেন্ড করতে হবে। তাহলে এগুলো কিন্তু করতে হবে। আর চাইল্ডের জন্য আর একটা কি একটা আছে, যারা সেক্সুয়াল অ্যাবিউজে আসছে, পক্সো, এটাও কিন্তু জানতে হবে। ঠিক আছে, তাহলে অ্যাডোলেসেন্স থেকে কি শুরু হয়, এটা হচ্ছে সামারি, যে আই ওয়ান্ট টু বি এ ডক্টর, আর আই ওয়ান্ট টু বি এ ইঞ্জিনিয়ার। ঠিক আছে, কেউ সিঙ্গার হতে চায়, কেউ টিচার হতে চায়, মানে কে কি হতে চায়, যে রোল মডেলগুলো কি, সেগুলো কিন্তু অ্যাডোলেসেন্টেই সবাই ঠিক করে।